2020 was definitely a year no one will forget. What started out as a typical year quickly changed for everyone. However, our mission to prevent suicide by reducing the stigma of mental illness and promoting optimal mental wellness remains the same. We know that our work has never been more important. We certainly did not let COVID stop us from reaching more people and finding creative ways to build connections, educate students, teachers, caregivers, coaches, and much more. To achieve our mission, we work in 5 pillar areas: stigma reduction, community engagement, schools and programming, policy and advocacy, and research. Through storytelling, community conversations, and educational events, we work to decrease the stigma associated with mental health. In order to increase conversations and decrease stigma, we launched the 1 in 5 of Us, Changing the Mental Health Landscape podcast. We continued our strong social media presence with weekly takeovers, teen contributors, and more. We added more individual journeys to our I Am 1 in 5 series and continued our X Out Stigma collaboration with Xavier University women's basketball, plus much more. All of this resulting in a total reach of over 1.4 million people. We activate the community through convening, relationship building, connecting, unifying, and mentoring the next generation. While we were not able to physically be in community with many, we did not let that stop us. With creative problem solving, we humanized the Zoom and created connections to educate individuals. We are able to hold virtual QPR Gatekeeper suicide prevention trainings, increase our student members by 50% on the Youth Council for Suicide Prevention, host a virtual Youth Mental Health Innovation Challenge, collaborate with Whitney Strong, and work with the Anderson Mental Health Collaborative. We hosted Miles for Mental Health in May, our annual Warrior Run, and much, much more, reaching over 3,500 people. We are so pleased to report that we have also increased our schools we are working with from 65 to 82, a 26% increase. Prior to COVID, the need for mental health education and programming was great. COVID has increased that need as isolation has increased as well. Suicide prevention programming is going to be more valuable than ever before as we enter the 2021-2022 school year. We look forward to continuing to partner with schools to create individualized mental health education plans from our well-vetted menu of 16 evidence-based programs, offering our Recharge and Reconnect program, classroom wellness resources, the State of Mind speaker series, mindfulness coaching, brain health network, and much more. For over 10 years, we have partnered with Cincinnati Children's Hospital Medical Center's Adapt for Life program, a 5-day trainer-led in-school program that teaches students the basics of mental health needs, from warning signs to positive coping strategies. Through this partnership, we were able to access CARES funding to bring this program to the elementary school level. Over the past 10 years, we've educated over 49,000 students. At 1 in 5, we understand the importance of system-level change. We know that it is crucial to advocate for policy changes at the state and federal level to support mental health education and protect those with mental illness. Our focus remains to pass legislation that will require K-12 mental health education. Research and data collection continues to be a strong priority. Data tells us where we stand and illuminates the path forward. Last year, we launched year 1 of the $250,000 Jacob G. Schmidt Lab Trust Grant, allowing us to partner with Cincinnati Children's Hospital Medical Center to analyze emergency department visits for mental health needs. We were able to identify the top 25 hotspot schools so that we can begin to work with those schools to create comprehensive mental health education programming. We are excited to share we are now working with 14 of the 25 schools and look forward to developing relationships with more over the next year. We're also happy to report that we completed our youth mental health evaluation with Dr. Stuart Slavin to look at what factors may be adding to mental illness increases in 4 area schools. We're excited to report that we're working with the floor communities to create programming and interventions for the identified factors. None of our work would be possible without a team of people, a dedicated community, an army of youth, and the vision of a world without suicide and a thriving community. If you or someone you know are struggling, please visit our website and select crisis resources to find the help you need.